Welcome to session two. Our session now is scaling culture without burning out your HR team. We've talked about retention starting from day one, and so now we're going to dive into how to scale that awesome culture you built without burning out. And so let's just drop in the chat for any new people who are joining us now. Where are you dialing in from, and what is your go-to summer drink? All right, Jay, I'll kick it to you first. We'll go on the panel really, really quickly as
Oh
people
wow.
are.
Free pitchers of beer at the pizza joint. Inside joke. Sorry. Oh my goodness. I'm from Raleigh, North Carolina, so sweet tea, but that's an all year thing.
Amazing. Celeste says pina colada. Kristen says Aperol spritz. All good options. Lori, Brandy, Jaren.
An
Oh,
unsweet tea girl. So I'm belong in the South, but not so much.
yep. I like the Aperol spritz. Nice and chilled in the summertime.
Hmm.
So good. Kathleen with the gin and tonic with lots of lime.
I dig that.
Oh yeah.
Mhm.
Hillary with the lemon raspberry water from Sonic or a cherry limeade. I also really like sour drinks, so that really speaks to me. Jaren, you're the last one on the panel.
Yeah, I'm up in Calgary, Alberta, so I'm gonna get an Alberta brewery, nice craft lager for me. Yeah, ice cold.
Amazing. Yeah, it's really hot, so anything ice right now just sounds amazing. Awesome. Well, with that quick little intro, thank you everyone for participating in the chat as well. We can totally get started with our session. And I just wanted to start by giving a quick shout out to our event partners, People Fluent, AIA Healthcare, Zipline, and Leadership Canvas. Y'all share our passion for elevating people and building thriving cultures. So we're very grateful for your expertise and for your support. And I'll drop the websites in the chat as well in case anybody's interested in checking them out. Really quickly, housekeeping items. If we haven't met before, hello, my name is Rebecca and I'm the community manager here at Bucket List. I'll be your host for this event. Really looking forward to spending the time together. If there's any tech issues or questions that come up, please pop it in the chat and I'll do my best to help out there. We do have the chat box open. Make sure your blue drop down is selected to everyone so that the comments aren't just coming to our a lovely panel here because a lot of it's pure gold and we'd love for everyone to be able to see it. Q&A box is open. You can put your questions in there so it doesn't get lost throughout. Professional development credits will be shared at the end of each session. And as well, we are recording all the sessions and putting it into a one-stop shop resource hub that'll probably be sent out early next week. All right, so I would love to take a moment just to set the context for this session. When I was thinking about how to introduce this session, this viral dog meme immediately popped into my mind. Does anybody remember this meme? Apparently it's from 2013. I totally thought, I didn't realize it was that long ago, but time definitely flies. And so the reason I thought about this when I was thinking about the session was that for a lot of us, it feels like we're constantly being pushed to our limits. And yeah, we're always being asked to do more with less. And for, HR teams, it can look like being tasked with scaling culture and engagement while also juggling admin work and, putting out fires and keeping the organization moving forward. And it's definitely a lot. Thank you, Tina, in the comments for shouting out that you also love this meme. I appreciate you. And so this is exactly why we wanted to have a session in the summit about this topic, because even if we're smiling or we're putting out all the fires, we might not be doing fine. And so Brandy, Lori, and Jay are here today just to share some practical ways to help set expectations, cut down manual tasks, scale and simplify culture building while making the impact measurable so that we can all focus on what matters without burning out. And so, to ground our discussion today, we really wanted to hear your thoughts on the following poll. Let me just find my poll here. Do we see the poll?
Hmm.
Perfect. And so we'll just let folks have a moment to answer those questions. And in the meantime, Jaren, let's introduce the panel. I'll kick it off to you to start. And once we're done with the intros, we can launch the poll and talk about it before hopping into our fireside chat here.
Awesome. Thanks so much, Becca. And yeah, love the meme. Great call on that. That's so great. Yeah, so excited, honored to be able to host today. Three awesome people. My name is Jaron, as mentioned. I'm an ex-volleyball professional athlete that got my HR degree and then moved into sort of true passion for culture and got in with Bucket List. And with Bucket List now for about 4.5, 5 years. And yeah, I'm really excited to be able to do things like this and host this awesome panel. So I'll pass it over for a quick intro to Lori.
Hello, good morning if you're on the West Coast. Good afternoon if you're not. I'm Lori Hamilton. I'm with Southwest Healthcare, Temecula Valley Hospital, the HR director here. Been here 10 years, been in healthcare 20 years, and overall HR a few decades, and we'll leave it at that. I also currently serve on the board of directors with ASHRA, for those of you familiar with that organization, and really happy to be a part of this today. Thanks for including me.
Awesome. We'll pass it to Brandy next.
Hi, everyone. I'm Brandy Bailey. I've been a nurse for 25 years. Spent most of my time in acute care with critical care, ER background, but mostly leadership and workforce transformation. 4 years ago, I went over to Aya Healthcare, spending time in MSP solutions and now working in workforce AI. Thanks for allowing me to be here.
Awesome. Go ahead, Jay.
All right. Yeah, Jay Graves. My career, I spent the first part of my career in the military as a human intelligence officer, worked a lot in special operations, and then went into the healthcare space, working for Roche Diagnostics, where I went from sales to VP of sales for North America, learned a lot in there. Healthcare is very passionate space for me personally and professionally. The president of Leadership Canvas, and we take a behavioral approach to helping build high performance organizations. We have a process called CLEAR where we really double down on culture, leadership, employee engagement, adaptability, and recognition. And we work across a lot of different industries, including healthcare. But again, I have a lot of personal reasons why it's very passionate, why I'm very passionate and it's close to my heart to be with this community. So excited to be here today with this great panel.
Awesome. Thanks so much, Jay. Yeah, Becca, you want to chat about the poll quick before we hop into the questions?
Let's do it. I just shared the results. Let me know if you don't see them. But for the first question, if people had more time back in their week, they say they would do more strategy, culture building, or connecting directly with staff and leaders. And for the second one, I'll just go through all of them and we can decide what we want to talk about. But for the second one, when teams are stretched thin, the things that are most likely to pause is culture engagement programs, team events, or social activities. And the last one, preferred way to measure culture impact, folks are saying employee engagement surveys is the preferred way, followed really closely by retention and turnover data. All right, panel, thoughts on some of these results?
Not surprised.
That's
Yeah, not
100%.
surprised.
The metrics.
Yep.
Yeah. I mean, I think a lot of people realize the impact that culture has in the workplace, but it's also, and also those quote unquote soft skills or human skills. Unfortunately, they're the first things that tend to be dropped. And then we wonder why. Then the tail of it is the turnover, lower engagement, and other things like that. So I'm not surprised to see this. And hopefully we can give some tips and tricks today on how to maintain that with all the busy schedules that we have.
Well said. I will hop off screen now, and Jaren, you can take over the show with our lovely panel here.
Yeah, sounds good. Thanks, Becca. So for our first question, just to kind of get the roundtable chatting, we just wanted to ask when resources are tight and teams are maxed out, what's one mindset shift or leadership habit that helps you stay focused on what matters? And Lori, you want to kick us off?
Sure. I think we absolutely need to stop hiring warm bodies. It's a time suck when we get and a money suck when we're hiring the wrong bodies and putting that energy into staying focused to hire the right people, even if it takes a little longer, absolutely is a shift in keeping us focused on what really matters. And I think that, you know, the challenge is often, but if we just have somebody, we can make things happen. Yeah, we all know what happens when the wrong person's in the job. And so just really shifting to hire the right people, get it right the first time.
I would agree with that, Lori. You know, I see so many times where people will say what you just said, right? Like we need bodies in here, but there's so much destruction that happens when you have that thought process. You really need that right person. One of the things that we do when we're consulting with an organization is implement software that actually has hiring software, behavior-based hiring software in it, so that as you're going through that screening process, okay, we have people that are in the window, or maybe there's certain areas that are outside the window, but it helps guide you through questions to ask in there. And if you can just, incorporate that into your workflow, it actually will save you significant amount of time in your hiring process, but also you have lower turnover, right? All the benefits, right, of hiring the right person. It's the right fit. So that's a way that we try to systematize it, because warm bodies just isn't the answer.
Just to double down on Jay and Lori, to refocus and remind ourselves of the purpose and ask ourselves what our mission is. As healthcare leaders, we're focused on our people and our patients, but exhibiting that people-oriented mindset and appreciating everyone's contribution to the mission keeps things in perspective.
Mm-hmm. I think that comes through a culture, right?
Yep.
Keeping it top of mind. It's not an add-on. It's not something that, oh, by the way, we're patient centric. It's people internal, it's patients external, and the whole holistic view of healthcare, is a cultural pillar that I think, really helps in this area.
Agreed.
Yeah, love it. And the ripple effects that it can cause too. Yeah, great points. Yeah, so kind of leading off that as well, I also wanted to ask kind of how do you set realistic performance targets for your HR team, especially with culture building often being not being easily measured. And yeah, Brandy, you want to kick us off on this one?
Yeah. As leaders, we're very familiar with those organized surveys and engagement scores. And if we can clarify our core values and translate those values into behaviors in the workplace, we can define that baseline culture and then set the targets.
Yeah. And realistic timelines, I think, that's one of the things that I tend to run into is people will call us in and say, we want to make a culture shift, right? And we'll do the assessments. And one of the things I'll share is like, this isn't something that you can just do in a month or 2 months. It's a journey, when you're trying to shift an organizational culture. And that's okay. Give ourselves some grace on that. There's sometimes when we're with people for a year, sometimes 2 years, as we're doing the change curve and the behavior change throughout that journey. Be realistic in your timelines, focus on those metrics that you have that would be the most impactful. Even then, there might be some that you can move faster on, and really work on that prioritization early on, and then stick with it with those timelines and those milestones.
Yeah, I agree with that. One of the things that I started doing was literally getting the buy-in from the individuals who are responsible for the actions that are going to drive those targets, hit those metrics, and having them be part of the goal setting. For example, my recruiters were looking at, all right, what are we going to reduce? What's our annual reduction of vacancy rate? And I can just pick the number, but having their buy-in to what's realistic, what they think they can do, what our commitment to the organization is, it absolutely has made a difference in our ability to not only hit the metric, but surpass it. And that's a method that I've started using a few years ago and has really helped with my team being able to deliver on some of those just hardcore HR metrics.
Awesome.
Yeah.
Go ahead, Jay. Yeah.
Yeah, I was going to say, I think the important thing there is that if you don't have buy-in from the group, you know, a lot of times people will want to do this at the executive level or with a C-suite, and sometimes that's out of touch. I have to say, a lot of times it's actually out of touch, especially when we'll do the surveys, and you know, I always work with the C-suite and the executives and get their viewpoint of the world, and then we marry that up with what we see in the actual data, and sometimes it's very divergent. And so I think that, you know, having people, frontline workers, you know, people from all across the different organization to come in and help inform that process puts their fingerprints on it, which then gives you that accountability piece of things as well, and that ownership at all levels, you know, versus, hey, this is coming from a high. I don't know where they got this from. Do they even understand what I do? Like, no, I've been able to be heard, speak up, and they've incorporated that into the plan.
Interestingly enough, we were starting to look at our 2026 goals and objectives, and I was cracking up because my recruiters came in with what they thought the reduction for next year should be, and I was the one that had to say, that's not achievable, guys.
Yeah.
Love the enthusiasm, but that's not realistic in healthcare.
Love it.
There you go. There's some buy-in. That's awesome.
Yeah.
And you're getting some recognition, Lori, in the chat. So, and everyone listening too, feel free to any thoughts, comments. Love the chat blowing up. So feel free to give us some feedback. We'll start to move now into kind of how it can actually scale. So we'll talk a little bit more about some low lift and high impact wins to help out. So maybe Jay, I'll ask you first, but can you share one process or initiative that had a big cultural impact that didn't require a huge time investment?
Yeah, I wish I could take credit for this idea, but I was actually talking about a very tricky client with somebody one day, and they shared this best practice with me, and I've used it, you know, repeatedly, and it's basically developed a form they call it the me form, right? You know, you talk about yourself. You know, what's your favorite food? What's your favorite drink? What's your top 5 bucket list? You know, if you had, you know, all these kind of different personalized questions on it. And then you can use that either for new hires, or you can you also use it with your existing employees. And so what we did is we did this across this organization, and then we sat down and we started to say, well, let's you know, embed this into our interactions, right? So if you have a team meeting and you know that Brandy likes you know, unsweet tea, you know, Lori likes the what was it, Shandy? I can't remember. It was some Appletini. I don't know, something really cool.
Fritz.
Pitcher of beer, which is a beer.
We'll just say
Spritz.
yes. Yes.
Um, maybe you can't have that. I don't know. At the meeting, and let's just, you know, maybe it's an
I'll
off.
have a milkshake.
Have a milkshake. So, but you know, little things like that, right? That personalize those experiences, you know, really help a ton. And looking at walking in the room and seeing people recognize that everything's been kind of individualized, but in a very simple way, goes a long way. And so that's a very simple one, that quick lift, easy to do, easy to scale across an organization, and you can take it so many different directions.
For me, it was simple gratitude practice, you know, building those relationships and then having simple expressions of recognition for an individual's contribution to the unit or department. And sometimes that was handwritten notes or an acknowledgement during a team meeting. It was just something very small, but it was very impactful.
Yeah, Brandy, I love that one. I think that a lot of times with tasks and things are going, you often start to lose sight of that. So I think that's also just a great practice for everyone all the time. And so maybe in the chat, if everyone wants to put in a gratitude or two on their day, maybe on their job, that kind of idea, we can get the love started here too. So yeah, and we use that chat box to be able to put some gratitudes in there. Well, maybe Lori, if you want to add something to that as well.
Sure. Yeah, I think, you know, I take what I hear from Jay and what I hear from Brandy, and that kind of is my response to the question. For me, it's been really focusing on the relationships, building the relationships with the team. My team is very driven by the personal relationship, so past the professional relationship, and what makes them tick is the personal. And so we just implemented, excuse me, every Monday after our morning huddle, we go around the wheel and everybody shares one item of what they did that weekend. So if they did something exciting, one of the people on our team is a new grandma, so we get to all enjoy the new baby stories. But everybody has the opportunity to share how they spent their weekend. Surprisingly, hasn't added any time to what we do, but it's made a huge difference for my team. They really love it, that positive connection. And then another thing we did that's such low hanging fruit, but has really made a difference culture wise, is a very intentional publication of our new hires and the internal promotions that we do each month. And it's really helped organizationally. Each unit knows who their new hires are. They know who's been promoted, but to be able to show as a facility, as an organization, hey, here are the new people. It's driving that culture of being welcoming, being inclusive, continuing to invest in our people with those promotions. So that, again, something so easy because HR has all the information. It's just a matter of what are we doing to make sure everybody sees it.
I agree with Lori. And over time, those kinds of things boost morale and build trust and increase engagement for the unit and reduce turnover. And it may start on a unit-based kind of thing, but then it impacts the whole organization.
Yeah. Yeah. And I think linking back to the kind of the title of this, right? Like, how do you scale it without burning out? This is something that scales. And I do see what you're talking about, Brandy, where it becomes, one area is doing it, like Lori, maybe somebody hears like of the great conversations that you're having in your team meeting, and then the next team wants to do it too. And then the next team and the next team. So it's so it starts to organically go through the organization because people really appreciate and they hear from, those leaders that are actually doing this type of thing. So it scales, it almost scales itself.
Awesome. Yeah, I appreciate it. Great answers. Yeah. So just to kind of get a little bit more into the weeds, also I was curious just to ask about what are some practical strategies to promote a culture of wellness in the workspace and as well. So, and Brandy, if you want to kick us off.
Yeah, I think it's important to address all aspects of wellness and have a holistic approach to that. And asking the staff what it is they need. And that may vary from physical wellness to social and to mental wellness.
Yeah, super important. One of the things that we learned, during COVID, nobody was taking in the hospitals, and I would imagine in just about any clinic as well. Nobody was taking PTO. And when COVID was over, we kind of forgot to shift back. And it was just, the burnout was just continuing. And so we made a very deliberate decision to make taking PTO easy, encouraging it, welcoming it, in some cases tracking it. Hey, Jay, it's been a bit since you took some time off. Let's get something on the schedule, shall we? And then really having the expectation with all of leadership, C-suite directors, floor supervisors, to model that behavior. I'm going to be taking time off and making it easy for everybody in the organization to take that time off, because we all know when it's difficult to do it, that's not helping our overall wellness of our workforce.
Yeah, I agree. I think, there's simple things that I've seen people do that go a long way. Instead of having a meeting in your little office room or whatever that setting is, maybe take like walking meetings, meet at the walking path or, meet here, meet there. Maybe you can't take it off site off of your out of your hospital system or wherever you're at, but there might be some cool areas there. A lot of them have walking paths, right? But just getting moving and getting people together, of course, thinking about being aware of like inclusivity, right? If somebody has trouble walking, then we'll do something else, right? But like something that you can do that's outside of the normal environment. I know some organizations really invested in those like walking pads, the walking treadmills that you can have with your laptop and your desktop and all that there. And you know, as I said before, you know, one of the reasons why I'm very passionate about this is not only because of physical health, but mental health. Mental health is something that, Lori, going back to your timeline, I think, you know, COVID really exacerbated a lot of things. I mean, it's always been there, you know, but it's something that I think is more normalized now and something that people can bring up now, put into their workforce culture. But I think, you know, also being very forward in that is really, really important, just to make sure that not only are we doing the physical things that we needed to be doing, but also what are those mental things? And to you know the point earlier of, hey, modeling PTO, right? Making sure people aren't in their use or lose, and then not treating them like they're ostracized for taking time off, which I know often happens in a lot of different cultures. So,
Absolutely.
you know, let's not do that. Let's model it like you said, but also let's take that to that mental health space as well. You know, if you need time, you need support, you need something, let's work with you.
Yeah.
Yeah, those are such amazing points. I think the other thing too, that just to kind of double down on a lot of the comments made, especially the PTO side of stuff, is also for leaders to lead by example too, right? Like they're taking the PTO as well, and they might be unavailable at times, but also sets the stage that it's okay for staff to do it as well. Yeah.
And one of the sometimes unintended positive byproducts of that is when the leader is taking time away, it empowers their team and it builds that trust of, hey, you don't need me. You guys manage just fine without me. And that can further enhance the culture of the organization.
Yeah, that's
100%.
really cool. Yeah. Sorry, Brandy, go ahead.
Nope. I was just agreeing with Lori.
Yeah. There's nothing cooler than when a leader steps out, they can look at somebody that they're developing or sort, you know, whoever else on their team and say, you've got the helm, you know, make your mistakes, fail forward, you know, it's yours. You're not going to break anything, right? You know, and see that confidence level grow. And then also on the team is amazing. I know for me as an early leader, I would not take vacation early on, even though I had a lot of leadership experience. It just was different for me in the civilian world. And my wife finally said, no, we are going on vacation. So we went. And after a couple of days, I was like, wow, this is great. And I came back and I was like, everything's running awesome. Then I had like an existential crisis. Like, do you need me? Like, of course, you know.
Managed
It was,
yourself right out of a job.
yeah, right, right. But I was so proud of my team, you
Right.
know, so proud. And I never would have given them that position to be in had I checked my selfishness and stepped out of the way.
Good thing for your wife.
Yeah.
Awesome. So yeah, we're gonna shift gears a bit and talk a little bit more about just how technology can help lighten the load as well. So kind of to kick things off, and Lori, I'll start with you, but just kind of curious to ask, what is the top influencer and strategy for successful adoption when rolling out cultural tools of a program?
Sure. Yeah, I think that it's absolutely essential that we find the right champion for every initiative. And there's such a tendency to, when you're looking for a champion for project, initiative, whatever it may be, to go to take a look and say, oh, who's available? Who has the bandwidth? And that's not always the right person. And I think it's so when you're looking for that champion, finding the most right person for a particular initiative, and then having these consistent check-ins, specifically to depending on where you are in your initiative. You've got some people who are going to be perfect to champion the project planning stage. Some people who are going to be your rock stars for the communication stage. My experience is the people who are great, who are my rock stars at the project planning stage, tend to be the worst people post implementation on the monitor modification repeat stage. And so changing up as needed who the champions are, depending on where a particular initiative is, to be able to also maximize the talents within your organization. It also, when you're moving these champions, it also has eliminated some of the what else is on my plate now? Because when we are given these initiatives and we're thinking I'm tasked with it to be the champion from start to finish, it can be pretty overwhelming. and being able to tap into talent, have multiple people as champions at different phases of a project, you also are able to tap into a greater variety of levels of the facility, and therefore improving the potential success of the implementation.
Totally agree, Lori. I also think that for successful adoption and implementation, to continuously ask, what is the challenge or the pain points, and what are we trying to solve for? So we don't have scope creep or we don't drift from the point of the project.
Definitely, yes.
Yeah, and I think one of the great things of what you're describing is moving the middle of an organization will get you a long way, right? Like a lot of times we'll focus on like the top or the bottom, right? But you have a huge middle, 60, 70 some percent of your organization. And a lot of times what I find is that's untapped. It's not real, there's not a lot of intentional actions there. They're just steady, right? But there's a lot of talent within there. And so if you do what you were talking about with individuals in the middle, stop picking all the same ones that you always pick at the same time, right? You're going to find that there's a lot of growth opportunities there. And I also love the kind of cross matrix, of what you were talking about, Lori, of like, pick the right person. Maybe this is the great person for this part, but then we're going to pivot to this person. We're going to pivot because then that gets people the mindset of, oh, I don't have to be all. I can be very, very comfortable in my strengths and highlighting my strengths, and I can lean on somebody else, which is also is a great organizational cultural thing to have, right? And also, it'll lead to moving that middle, gaining, increasing confidence, and people like to be recognized in that way. I know it sounds kind of funny, but like, being, hey, I'm busy, but you picked me to be the communication lead on this new project. Like, I'm going to find time. I'm going to learn. I'm going to find time, and it's something else, and I'm being recognized and seen.
They're also building their own network of peers.
Mm-hmm.
Yes.
Mm-hmm.
The teamwork and collaboration of all increases when you've got more people who are sharing, you've got more people who are highly vested, even though they may not be responsible for every element of the implementation or initiative.
Exactly.
I think those are such amazing points to Brandy's the scalability, and also too, if you get caught by, if there's one person that always gets things done, then they have to take the whole entire process, right? And then we start building towards that burnout all over again.
Yep.
So being
Yep.
able to empower people to do their strengths as well really keeps them engaged. So I love that too. Yeah. And then to take one step further as well, I was just kind of curious on if there's any system or tool that your team has adopted that's kind of lightened the load for the HR team's burden. And Jay, we'll start with you.
Yeah, definitely. Like I said at the beginning, we're very behavior based. We think that it's very important to understand yourself and the individuals that you're working with and how you interact, right? And so we use a lot of different behavioral profiles, type, strength finders, this, but for a system, for moving a system, the best holistic tool that we found that we use is predictive index. Absolutely love the tool. It helps you everything from hiring to those interactions to team views to special projects. I mean, the whole, holistic look of things. So that's the tool that we tend to lean on the most when we're doing organization-wide changes or even a large department. It helps out quite a bit. And it's kind of funny because, the people that I work with the most, I would say, are HR and then some of the executives and learning and development, right? And whenever you say to particularly HR, right, it's like, hey, one more system, seriously? Like we've got all these other systems that we're working within. But what we found is that there's really, really good adoption and support there. And so it's not a very heavy lift at all to get this implemented. You need those champions that we kind of talked about a little bit earlier to really model things. But once people see that you can hire more effectively, faster, and all the benefits coming from the different interpersonal conversations, mentorship, all the different things that you embed into this, that you find that it actually saves you a ton of time. So that's one that we tend to lean on, but the others are great as well. It really just depends on the situation.
know if I have one tool, but more so a generalized comment, that can spread across like HR for recruitment or nursing for staffing and scheduling. But it's really to look for ways to create automations to take those manual tasks off your plate and to reduce that administrative burden.
Yeah. We, sorry, go ahead, Lori. Sorry.
No, go ahead.
No, ma'am. You go.
I was just going to say that, piggybacking on that, Brandy, because my response to Jaren's question was really, oh, well, this is a tad embarrassing because we're not quite where I'd like to be technology wise in my HR department. So we're continuing our journey with document imaging, which is, absolutely that automation. And, for many, if not everyone on this call, those who are maybe where I'm at, scratching our head saying, the technology's out there. Why do we still have paper HR files? So it's in process for my team. And so they, I think the thrill for them is knowing that it's not forever, that we continue to use these paper files and we can get technology to work for us. And then one of the things I'm very looking forward to that is going to improve some things for my team is our very recent partnership with Bucket List as it relates to employee recognition and engagement. So we're excited about that.
Yeah, I think that's great. One of the things that we looked at is the different categories of clear, and when you look at the ROI and ROAS for marketing companies, we found that focusing on leadership, we would get about a 24% bump in effectiveness and as related to profit and everything else. Equal to that, you would think that it would be culture, employee engagement, all these other things. Equal to that, reward and recognition. So exactly, partnering with somebody like Bucket List, your Brandy, your recommendation, right? Automating those recognition type things,
Yeah,
can actually give you as much of a bump as putting your leaders through leadership development programs. Like, how easy is that, right? Especially since a lot of it can be automated, or make it, or even just make it easy, right? So I think, yeah, it's a great shout out, Lori.
Awesome. And yeah, Laura, it's very excited obviously to work together, of course. And one thing as well that I'd like to add is also just to help kind of tie it into the piece that we talked about previously. Obviously, I haven't worked in a healthcare system, so you have to take my advice with a grain of salt here. But also like little projects or finding ways that the peers and other people within your organization are lightening their load with different automations and different tools and technologies, and having a collaborative session to share those best practices. So it's not just all on leadership to be able to have to say, this is what we're all going to use and things like that, but people actually being able to kind of check things out on their own and have suggestions and kind of, involve them in the whole decision making, which really ties it into a lot of the questions that we kind of had previously as well. So awesome answers. Thanks, everyone. So the next up is we want to kind of now shift the focus to really trying to empower leaders. So Jay, I wanted to start with you and just kind of ask what you've seen that works when it comes to empowering frontline leaders to really sustain culture.
Yeah, so for frontline leaders, a lot of the challenges early on is maybe the senior leaders not wanting to give up what they see as power or control. So a lot of times we have to start there and getting them comfortable with delegation, things like that. The best thing that you can do is empower and support. Let them also be able to fail. I say it all the time, fail forward, right? You learn so much. You learn so much from that. But also making sure that you're supporting them through their leadership journey as well. If you're familiar with like situational leadership, then, you're going to come out of the gate, all enthusiastic, and then you're gonna be like, oh my gosh, what did I sign up for? And then you start to get into comfort and mastery, right? And so that takes a different kind of support and leadership as your leaders are going through that. So I think that's important. The other thing is, as you're doing your culture work, really making sure that the leaders model that. There's a lot of times when you walk into an organization, a lot of these great culture statements and value statements, and maybe they're on their badges and stuff, but then you see them in action and, business is taking the priority, right? Or this is taking the priority, and you start to lose focus of that. And I'll be honest, that happened with us at my first team that I had when I was at Roche, where we were very patient centric, and we talked a lot about that. But when times were tough, it patients started going away. And so one of the things that we did on the team was, instead of saying like, oh, market share or this much profit or whatever, we converted that to lives saved. And so instead of sitting there going through my business reviews with my team, they would come in really proud and they would say, we saved X hundreds of lives this quarter by implementing this with this hospital system, so on and so forth, right? So we really tried to embed the patient narrative through everything. We started to have patients come visit us in the office, created a budget to send people. I was in the diabetes division, so we would send people off to like diabetes camps for youth, free memberships and support for things like JDRF, and so just embedding people into that piece of the culture, and also embedding our end user, which health systems, right? You're in front of them all the time. But I think, not every frontline leader in that environment is patient facing, but they got to remember what their role is in that mission. What is that North Star for that organization? So you might be in the accounting department or the billing department, right? And you're not close to patients, but you still have a major impact on what you do for the patient. And you have to find those and bring those up as examples and reinforce those.
I think that those are some really excellent thoughts, and it really aligns with where my head goes with frontline leaders can be most successful, in my opinion, when we give them the ability to be creative with their teams. And as you said, not everybody in a hospital is leading a direct patient care team. And so these sometimes rigid frameworks of culture, engagement, patient experience, fill in the blank, these major initiatives, it's not a one size fits all. And so giving our supervisors the autonomy to be creative, they know their teams best, they know what's going to work for their teams, the best way to recognize their teams, the best way to motivate their teams, just as the example you gave, Jay, of turn it into people, make it human. And when the supervisor is given the opportunity to be creative and make it meaningful to their team, then the sincerity of what's happening is also felt, versus these, as I said, sometimes rigid frameworks that can come off as disingenuous to folks. And I think that really is one of the keys to organizational culture, is when individual department culture is established, and this is how we contribute, this is how the accounting department contributes, this is how the nursing units contribute, and we all have the same core values and the same mission and vision, but what it looks like can be different.
Yeah.
I can't make any of those any better, except that, we all tie everything to engagement scores or metrics, and all of those are great. And I'm an analytical girl and I love all of those. But I think the biggest impact is always a story. Somebody will always remember a patient's story. And if we can tie it all back to an impact on a patient and how we all work together to make that story a success, that's how you'll get all of that engagement and how everybody will work together.
Yeah, very good point.
Yeah.
Yeah, absolutely. There's so many amazing stories that happen every day. So being able to help share and portray those really will help double down, and especially around, Lori mentioned too, around the core values and things like that. So tying those back in is also super helpful. Yeah, good stuff. So I wanted to just kind of go into kind of a final round before we hop into questions and Q&A. Speaking of which, for everyone listening, happy to answer questions as well. So you can use the chat, or you can also use the Q&A at the bottom of your screen there to ask some questions. It looks like we'll have some time to cover those. So feel free to fire away in there. But before we get to those questions, I just kind of wanted to kind of go around the room, just to kind of ask a real direct, kind of very actionable question of what's one thing leaders can stop doing this quarter to make space for what really matters. And Jay, I can kick it off with you.
Sure. I think we've been saying do more with less probably in most of my career, and things don't seem to be slowing down. And what I tend to see is that we put too many priorities and competing priorities on leaders' plates. So what I would say is, take a moment to sit down and really think about and prioritize what is going to accomplish the mission that we need to do, right? And you can chunk those up into phases by time or whatever. What are the immediate things that need to be done to continue to move forward and to continue to move our organization's culture in the direction that we want to have it. And then when you do that, it's almost like having an agreement, right? Amongst the leadership team of these are the things that need to pause. These are the things that we need to focus on. And if something else, another priority will come in, because it always does, multiple priorities will always start to come in, then have that very transparent conversation of what drops then, if anything, right? Or what does this replace? But we have to give people space to be able to operate, because being a mile wide and inch deep doesn't get you anywhere. It does get you somewhere. It gets you to frustration, and it gets you to not being efficient. So being able to agree on those boundaries and that prioritization goes a long way, because it gives you a clear vision of what you need to do every day.
I think the back piece of that, Jay, is once it's been established what's got to drop, is we got to drop the guilt for the things that we dropped. We have to get rid of, if it's determined that we're going to drop these things and priorities on these things, then they're dropped. We're not going to think about them. We're not going to feel guilty about it. And we've got to make sure that our leaders and our teams don't carry that guilt. Easier said than done. But we have to create an environment where it's okay to not be guilty about those elements. And then it gives us the opportunity to all that energy that we're wasting on being guilty, right? To focus on the connections, focus on what matters.
Yeah. And things that are getting dropped, somebody might have hurt feelings about that, right? Because organizational priority might put you lower here, but for you, that's your priority number one because of something, right? So what's also really important is when you're explaining what the priorities are and what's being dropped, is the why. Really make it have clarity on the why, and then see how you can reframe those individuals to supporting the priorities that you have identified.
Yeah.
I think I'd have to say, stop using our one-to-ones for company or department status updates. Share those in a broader context for like staff meetings or company-wide meetings, and spend the time chatting with your employee to find out what they need and how they're doing, and to practice listening.
Awesome.
Yeah, love that.
I think one of the things that's worked well for me, Brandy, it's such a good point, is with my one-to-ones, it's their time, whatever they want to talk about. And, we all know recognition is very individual. It's very interesting to me with each of the people who I do one-to-ones with, and even skip one-to-ones. Some will come and just want to talk personal and not a stitch of work. And others, it's all work. And others, it's a happy medium. But it's great because it's their time, as you said, Brandy. And so they walk away with, that was productive because it's what I wanted to do.
Yeah.
Awesome. That's great answers. I think it's all great stuff to be able to be actionable on too, right? Which is all the definite point to it. So we do have about 5 minutes here to do some Q&A. So I appreciate everyone submitting questions, and I'll just walk through a couple, see how much time that we have for. There's a couple that were pre-submitted that I loved, and I'm gonna start with there. So definitely get some shout outs to people putting in the questions, but maybe to the group, whoever wants to start. But Belinda asked, how can others in the organization be more mindful of what's on HR's plate when it comes to collaborating on culture projects and especially wellness? That was a great question. Anyone want to tackle that first?
You know what? I will say we in HR are the worst at tooting our own horn and letting people know what we're doing. For some reason, we feel the need to just silently and quietly go about managing everything. That's how we feel, I think, so often. We have to get out there, and I have learned no one's going to know better than what we're working on than us. So whether it's a monthly dashboard that you publish, whether it's town halls that you ask to have 5 minutes to report out on, you know, being asked to be invited to staff meetings and have FaceTime with different departments during their staff meetings to share. Here's what we're doing. Here's how many people we hired. Here are the new wellness vendors that we have coming on. Any of those kinds of things. But if we don't acknowledge that we have to drive it, we are never going to see. No one's ever going to take the time to say, hey, here's what HR is doing for culture and wellness. We've got to be the ones driving that.
That's a great point, Lori. Yeah. Anything else to add from the other two, or?
Can't
Awesome.
speak from an HR perspective
Mhm.
because I'm not HR, but I did work in a adjacent department. I managed a large pool, so we were kind of the redheaded stepchildren. So nobody really knew what we were doing because we weren't an inpatient unit per se. So we did do rounding staff meetings similar to Lori. Like we went and shared what was going on, and we're as transparent as possible. So I think that that's really the two takeaways. Go and tell people what you are doing, and tell them as much as you possibly can, both to your own staff and to, adjacent staff. Be transparent. So that would be my two takeaways there.
Yeah. Just from the consultant perspective, it is funny, Lori, because whenever I'm working with HR, you're right. They don't want to toot their own horn. They're just doing the work, right? It's all about people. And so one of the things that we do is we come up with a communication campaign, which you described beautifully. Are there town halls, grand rounds? What are the different things that you can do to just update people on what you're doing? Because it does impact them, right? Oh, we're researching new benefits. We're doing this, we're doing that, right? Like, might seem like that's just my job, I'm supposed to do that every year, but it rolls down, right? It impacts everybody. And so I love the humility. But it is great to have a plan.
Awesome, Jay. And actually, we have time for one more question, and the humility piece actually ties into it, so that's actually perfect. But Shasta made a great comment, great question in the chat box there. But asking what are some tactics that can be done to encourage leadership to take a cultural competence or humility training, but also be accountable to the learning by creating and following through with actions. And the part two of that as well is if everyone has any recommendations, affordable recommendations for good training for leaders.
Yeah, I mean, this is something I run into all the time because this is what we do. And I spend a lot of time with the C-suite and the executives because without their buy-in, then things will just fade away, right? You won't make progress. You'll actually do more harm than good because you usually find very enthusiastic individuals at that front line and middle of the organization and everything else, right? And so they'll get enthusiastic. They'll know that we're doing a survey and like what's going to come out of it. And we're going to do this, this, and that, right? And then if their C-suite disappears or their executives disappear, it creates a lot of anger, quite frankly. And so I'll usually go through the metrics, what we've done, why it's important on their leadership journey. I think, for me, I don't know, people sometimes get enamored with, special operations and this. And I'm like, we did this cultural competency and humility in special operations. You think that it's whatever people's average vision of that, right? But we had to always do cultural competency things, especially with different countries we were working in, different organizations that we were working with. We had to understand how they worked and how we could work with them. And so I think a lot of times it's chipping away at that. Plus, we have the metrics that show if you do this and you show up, you're worried about the bottom line, you're worried about this, you're worried about that, right? This directly impacts your business. So a lot of times making that people strategy and connecting it to the business outcomes is where their brains will click. And then, quite frankly, you become an accountability partner. I need you to communicate this out on these times, right? I need you to do this and that. It only takes a little bit of time for them to sit through, some of those sessions before they start to say, like, this is something new for me. Or there are some things that I forgot early in my leadership journey that I'm remembering now that are exciting. But I think it's just really important to spend time with those key leaders and those key influencers and those thought partners that are going to be influential through that journey, and really understand what's their hesitancy and then overcome that hesitancy for them. Sometimes you'll see they're not confident in this, or they'll say that's HR's job. I hire great HR people and they're focused on culture, and I've empowered them by giving them a big budget, or whatever, right? No, that's not how it works. They're your partner, but you're the leader.
Yeah. Jay, that is such an important part. On no engagement survey ever did people say, I don't see HR enough. They want to see senior leaders. They want to see the executives. And so that's such an important part. And then, as you said, tying it into what makes it work. I was going to mention, I think that there's just as with pretty much anything from our development, we all have strengths and weaknesses. And as those senior executives in particular, often their skill set is not in the soft skills.
Yeah.
And so we have to tie it, as you said, tie it to something that's meaningful for them, and then create a plan that is in bite-sized pieces that they can learn to be successful, because for some of them, they're never going to, their sweet spot is not being, quote, warm and fuzzy. But if one of the areas they have direct oversight over, or not direct, but indirect oversight, is an area that needs the warm fuzzy, they've got to be able to, situationally manage and shift. And then I think the accountability, I know there was a part of the question was, how do you hold them accountable? Well, it's first identifying, as you said, what are the needs by individual, not a one size fits all approach. What are the behaviors, the actions, the competencies? Provide that to the individual, and then the accountability is there, whether it's an annual evaluation, whether it's retention rates, turnover rates for their scope of responsibility, whether it's, their bonus metrics. There's a lot of different ways you can hold them accountable.
Yeah, very much
awesome.
so.
Yeah, well, such great points. Really appreciate that. That's great. Yeah. And then I know we have I only think a couple minutes left, so I think I'll invite Becca back to kind of finish things up.
Thank you so much, panel, for answering all of those questions. You got lots of kudos and snaps in the chats and the reactions realm of things. So I'm sure what you said really resonated and folks are taking things away for their own practice. All right, so we have just a minute left. So sorry, panelists Misty, Shannon, Zachary, I see y'all in the back. So apologies, we're gonna take another minute here just to wrap things up. But I would love to give each panelist a little bit of time to just talk about the important work that they're doing. And let us try to keep it to 30 seconds so we can get through. So Jaren, you go first, and then I'll flip the slide and it'll be the next person's turn.
Yeah, absolutely. So love the chat today. That's a lot of what Bucket List tries to help combat and automate and save time and build culture and really try and target retention rates and engagement rates to really make a difference within your organization. So we're a platform for rewards and recognition to really go above and beyond with your culture. And we actually specialize as well in the healthcare space and build healthcare specific programs to help really attack those, again, those retention and engagement rates. So yeah, I'd love to chat further and see how Bucket List can help you out.
Thank you. Lori, anything you want to share about the work that you're doing at Temecula Valley Hospital?
Nothing in particular. We're just super happy to be providing great care to our patients in this community.
Thank you. Brandy for Aya.
Yep, many of you know that Aya Healthcare provides contractual labor to healthcare systems. We do have a new product that is working on staffing and scheduling solutions, providing that forecasting. So if you are looking to reduce that administrative burden, give us a look.
Thank you. Last but not least, Jay.
Yeah, during my introduction, I talked a lot about this. This methodology is something that we found is a framework that really helps make this real for organizations and for individuals within the organization. Look, we just want to empower everybody within the organization to be their best, to be in an environment where they can thrive. And that's what we do.
Amazing. Well, thank you all so much for your time today, panel, and to the community as well for submitting all your questions, all your thoughtful comments. We really appreciate all the participation.